Morning. I have an appointment. I think it's through admissions first. I have a letter.
Yes, that's right. Everyone comes through us first. Let me take a look.
Hello, and welcome back to Medical Voices, the podcast where we learn the language of healthcare, one real conversation at a time. I'm Tom.
And I'm Nadia. Great to be back.
Before we start, as always, a quick but important note. Everything you hear on Medical Voices is here to help you learn the language of medicine. We are not here to give medical advice, and nothing in this episode should be taken as clinical guidance.
We are language teachers, not your doctors. Though today, for the first time, we are leaving the GP clinic behind.
If you have been following along, Mr. Davies has had his first GP appointment, collected his medication from the pharmacy, gone back to Dr. Bennett when a new symptom appeared, and left her surgery with a blood panel request and a referral to neurology. Today, he is at the hospital.
New environment, new staff, new vocabulary, and the first person he meets is not a doctor, it is an admissions nurse.
10 terms, a full hospital intake role-play, a breakdown and a quiz. I will be Mr. Davies today, a little uncertain, carrying a letter I hope explains everything.
And I will be the admissions nurse. Let's get you checked in.
10 terms before the dialogue. Nadia will give you the word, the definition and an example. Pause and repeat whenever you need to.
Terms 9 and 10 are ones you have heard before. We will flag them when we get there. Term 1. Admission. The formal process of registering and accepting a patient into a hospital or clinical department, both administrative and clinical. Example. Mr. Davies presented at admissions with his referral letter.
Term 2. Medical history. You heard this in episode 1 at the GP clinic. Here it comes again, because hospitals collect it independently. GP records and hospital records sit in separate systems. Example. The nurse took a full medical history before opening the hospital file.
Term 3. Referral letter. A formal document from a GP requesting that a patient be assessed by another clinical team. It summarizes the patient's history, the reason for referral, and the investigations requested. Example. Mr. Davies handed over Dr. Bennett's referral letter at the admissions desk.
Term 4. NHS number. A unique 10-digit identifier assigned to every patient registered with the NHS. It links your records across every NHS setting: GP surgery, hospital, specialist clinic. Example. The nurse asked for his NHS number to open the hospital record.
Term 5. Informed consent. A patient's voluntary agreement to undergo a procedure or investigation given after a clear explanation of what it involves and any associated risks. 3 elements: informed, understands, agrees freely. Example. The nurse explained the MRI and obtained informed consent before proceeding.
Term 6. Ward. A designated area within a hospital where patients receive care, typically organised by clinical specialty. A neurology ward, a surgical ward, a medical assessment ward. Example. After completing the paperwork, Mr. Davies was directed to the medical assessment ward.
Term 7. Current medication. All drugs, supplements or treatments a patient is taking at the time of admission recorded to prevent interactions and ensure continuity of care. Example. The nurse asked Mr. Davies to list all his current medication, including anything over the counter.
Term 8. Investigation. A clinical test or procedure ordered to gather information about a patient's condition. Blood tests, MRI scans, X-rays, all investigations. The word signals information gathering, not diagnosis. Example. Dr. Bennett had requested 2 investigations, a blood panel and an MRI.
Term 9. Allergy. Recall from episodes 1 and 2. Every point of care checks independently. The hospital admissions nurse will ask again, separately from the referral letter. Not an error, a clinical safety standard. Example. Before completing the admission, the nurse verified his allergy status directly.
And term 10. Referral. In episode 3, Dr. Bennett issued a referral. Today, Tom arrives with the referral letter that records it. Same word, new stage. The decision, now a document. Example. Without a referral, the hospital cannot process the admission for a specialist appointment.
10 terms. You will hear every one of them in the dialogue coming up.
Ready when you are.
All right, and now, as always, it's time for our role play. Today, I'll be the admissions nurse.
And I'll be the patient. Mr. Davies, first time at this hospital. Let's go.
Good morning. Welcome to St. Matthew's. How can I help you?
Morning. I have an appointment. I think it's through admissions first. I have a letter.
Yes, that's right. Everyone comes through us first. Let me take a look. Right, so this is a referral letter from Dr. Bennett at Elmwood Surgery. Mr. Davies. James Davies?
Yes, that's me.
And your date of birth?
The 14th of March, 1983.
Thank you. Do you have your NHS number with you? It will be on any previous NHS correspondence, a GP letter or a prescription.
I think so. Yes, here, on the appointment letter, 485-231-6790.
Perfect. I can see your record. I am going to open a hospital admission file for you. I will need to ask you a few questions first.
Of course.
Let's start with your medical history. I know Dr. Bennett has some of this in the referral letter, but we collect it independently here. Our systems do not automatically share with GP surgeries. Any significant past illnesses, surgeries, or ongoing conditions?
Nothing major. I had my appendix out about 8 years ago. The main thing at the moment is the headaches, which is why I am here.
And your current medication?
Amitriptyline, low dose, 1 tablet in the evening. Dr. Bennett prescribed it about 6 weeks ago. And occasional ibuprofen, though I have been trying to avoid it.
I will note both. Now, any known allergies, medications, foods, latex?
Yes, penicillin. I had a reaction as a child.
Noted. Allergy to penicillin. I can see it is flagged on Dr. Bennett's letter as well, but we always verify directly. Thank you. Now, Dr. Bennett has requested 2 investigations, a blood panel and an MRI of the brain.
That's right. She mentioned the MRI, but I did not really know what to expect.
Let me explain both briefly. The blood panel happens at the phlebotomy clinic, just down the corridor, no preparation needed, about 5 minutes. The MRI is a scanning investigation using magnetic fields, no radiation. You will lie still in a scanner for approximately 30 minutes. It is noisy, but not painful. Before I complete your admission for the MRI, I need to go through the consent process with you.
Consent?
Informed consent. We explain what the investigation involves, make sure you understand, and you agree freely. It is a legal requirement and a clinical standard. I have explained what the MRI involves. Do you have any questions about the procedure?
Just, is there anything I need to avoid?
No metal objects in the scanner. no jewellery, no piercings. You'll be asked to change into a hospital gown. Are you happy to proceed?
Yes, I am.
Thank you. I will note your consent in the file. So, the plan for today. Blood panel first at phlebotomy, then the MRI this afternoon in radiology on the second floor. After that, the medical assessment ward. A member of the neurology team will review your results and speak with you before you leave.
And how long will all of that take?
Around 3 to 4 hours in total. We will give you a pager. You can wait in the main area. If anything comes up, the admissions desk is right here.
Thank you very much.
Good luck, Mr. Davies. You are in the right place.
3 key exchanges. A little more slowly. Listen for how clinical information is gathered and verified at admission.
Pay attention to the structure. Identity check, history, consent. Do you have your NHS number with you? It will be on any previous NHS correspondence.
Yes, here, on the appointment letter. 485 231 6790.
Perfect. I can see your record. I am going to open a hospital admission file for you. Any known allergies? Medications? Foods? Latex?
Penicillin. I had a reaction as a child.
Noted. Allergy to penicillin. I can see it is flagged on Dr. Bennett's letter, but we always verify directly. And your current medication?
Amitriptyline. Low dose, 1 tablet in the evening. And occasional ibuprofen, though I have been trying to avoid it.
Before I complete your admission for the MRI, I need to go through the consent process.
Consent?
Informed consent. We explain what the investigation involves. Make sure you understand and you agree freely. I have explained what the MRI involves. Do you have any questions?
Just, is there anything I need to avoid?
No metal objects in the scanner. You will be asked to change into a hospital gown. Are you happy to proceed?
Yes, I am.
Let's break that down. 5 things worth looking at closely.
Vocabulary, clinical process, and a system point that is important for anyone working in or preparing for an NHS environment.
Point 1. Why did I ask for the medical history when Dr. Bennett's referral letter was right in front of me?
Because NHS GP records and NHS hospital records are not automatically shared. They sit in different systems. The hospital cannot pull your GP file. The admissions nurse collects the history directly from the patient, not because the GP record is wrong, but because the hospital does not have access to it. Understanding this is essential for anyone working in the NHS. Point 2. Referral and referral letter. 2 different things that are easy to confuse.
A referral is the clinical decision. Dr. Bennett deciding that Mr. Davies needs specialist care. A referral letter is the document that records and communicates that decision. It contains the patient's history, the reason for referral, and the investigations requested. In OET writing, you may be asked to produce one. Knowing what it must contain is a directly tested skill. Point 3. The NHS number. 10 digits, unique to you. It links your records across every NHS setting for your entire life.
For international healthcare professionals starting work in the NHS, asking for and giving an NHS number is a day one practical skill. The phrase in the role play, "It will be on any previous NHS correspondence," is the standard way a clinician helps a patient locate it. Point 4. Informed consent. 3 elements. All 3 must be present.
The patient must be informed, given a clear explanation of the procedure, its purpose, and any risks. The patient must understand, verified by inviting questions. and the patient must agree voluntarily, freely, without pressure. In the role-play, I covered all three. Explained the MRI, asked for questions, then asked directly if he was happy to proceed. That is the clinical and legal standard in the NHS. And point 5, the register shift. Compare this role-play to episode 1. The tone is different.
At the GP clinic, the conversation was warm and exploratory. At hospital admissions, the nurse is completing a structured intake process. The questions are more direct. Can you confirm your date of birth? I will note your consent in the file. Efficient, professional. Still patient-centered, but operating to a different rhythm. Both registers are clinical English. Both matter.
That is what the hospital arc of this series is building.
Quiz time, 3 questions. Nadia, ready?
Always.
Question 1. What is an NHS number? And why does the hospital ask for it at admission? 5 seconds.
An NHS number is a unique 10-digit identifier assigned to every patient registered with the NHS. The hospital asks for it because it links records across all NHS settings. Without it, the hospital cannot locate your existing records or connect today's visit to your medical history.
Question 2. What are the 3 elements of informed consent? 5 seconds.
The patient must be informed, given a clear explanation of the procedure and any risks. The patient must understand, verified by inviting questions. And the patient must agree voluntarily, freely, without pressure. All 3 must be present for consent to be valid.
Question 3. Why does the admissions nurse collect a medical history even though the GP already has one? 5 seconds.
Because NHSGP records and hospital records are held in separate systems that do not automatically share information. The hospital cannot access the GP file. It is not duplication. It is how the NHS system works.
3 questions, 3 clear answers. Well done if you got those. The PDF transcript has everything you need to review.
That is episode 4. Mr. Davies is checked in. Blood panel done. MRI booked for this afternoon. Next time, we are in the assessment ward. Episode 5 is all about vital signs and clinical assessment. Heart rate, blood pressure, oxygen saturation, temperature, respiratory rate. The language of monitoring a patient. Tom?
See you next week.
See you next week.